It's time for healthy living. Do you suffer from knee pain?
Well, we are learning the causes and how you can possibly find some relief with physical therapist Dr. Matthew Gordon with the Mettler Center. Good morning, doctor. How are we doing today?
I'm doing great. How are you guys doing?
So far, so good. Can't complain. So can you explain to us what other joints directly affect the knee?
Yeah, so we actually have a graphic on this that kind of explains it. It's basically a picture that shows the interactions between different parts of the body. So as you can see here, the hip is really that number one position. And if someone has weakness in their hip, it just starts this cascade of bad mechanics and bad posture down the leg. So if you have weakness in your hip, your knee is going to drift in towards the other knee. You can see both the thigh and the shin actually internally rotate towards the other leg. And then your foot will actually pronate. And we hear a lot about, flat feet and pronation. But what we don't hear a lot about is the interaction between a weak or a strong hip, a weak and a strong foot, and how that can actually affect that knee. My favorite way to actually always think about the knee is kind of like a victim joint. If the hip isn't functioning properly, the knee is going to be the victim. If the foot isn't functioning properly, again, the knee is really going to be the victim there.
So is there a way that we can figure out if we have weakness in our hips or our feet?
Yeah, we gave you guys a chart for this too. So if you actually look at the chart, you can find your age, but basically there's a way to measure how strong your hips are just by doing simple sit to stands. So for a female, we'll take a female 65 to 69 years old. So in 30 seconds, she should actually be able to do 15 sit to stands with really good form, minimal effort. She shouldn't feel a spike in her exertion. But if you're not able to do this, what it shows is that there's a weakness in those hips. And like that first graphic showed, if there's a weakness in your hips, that's going to lead just to this negative cascade going down the leg, bad posture in the leg, and it's really that bad posture that leads to bad mechanics. Bad mechanics leads to irritation. Irritation leads to inflammation. And then it's just this vicious cycle from there where it's just pain, mechanics get worse, more inflammation, more pain, and then that's just what you're dealing with until someone really helps you get out of that cycle.
So, doctor, what are 3 things that you can do today to start improving the strength in both your legs?
Yeah, so research has actually shown that some of the best exercises for improving the strength of the leg would be a bridge, would be a clamshell, and would be just a simple step up. So incorporating those exercises just into your daily life is a great way to go because they're simple, they're easily done. You can do them first thing in the morning, midday, last thing right before you go to bed. If you have a staircase in your house, you can just incorporate a few extra efforts or a few extra times up and down those stairs to really get the benefit. I think the biggest thing, though, that people do wrong with exercise is they do them too quick. People are sitting there doing exercises and reps like this, and they're not keeping the muscle under tension long enough. And if you don't keep the muscle under tension, it's not going to be stimulated to actually get stronger. So you want to make sure you're doing slow, controlled repetitions so that those muscles are actually stimulated to improve.
And is this one of those things where if we find ourselves to have pretty weak hips or feet, that we just continue to do these things and it'll help, or is there some extra help that we might need?
Yeah, so in the beginning, you're looking at maybe like 4 to 6 weeks to really start seeing an improvement with strength. But at a certain point, if you're doing the same exercises and either the pain or the bad mechanics don't seem like they're resolving, that's where you really do want to have some kind of an assessment. It's really easy to think you're doing something right until you actually see yourself or until someone else sees you. And a lot of times, we don't even know what we're doing wrong, and that's where it helps to have someone who kind of has that trained eye to look at you and say, oh yeah, you are falling down at your foot here, you are dropping in at the knee. And that's really where like those assessments come in. I mean, we do these free 30-minute assessments for people if they're having pain, if they're just curious as to what could be weak and how could they prevent issues in the future.
And doctor, at what point do we need to reach out to a medical expert if we are having some knee pain?
Yeah, I think, that's always the question, like, when do I actually do this? For me, at least, I have a fun pain tolerance just because of my history in sports. What I always tell people is, if you have a pain and it's still bothering you, even within just like 3 to 7 days, it wasn't just a minor strain. A minor sprain should be starting to resolve even within a week. So if it's longer than a week and you're still hurting, that's when you're thinking, okay, I need to probably get some help, because it really just compounds. It's like an onion. It's just layer on top of layer the longer you wait on this. The other thing to think about is, was there a mechanism of injury? I mean, if you rolled your ankle and you know there was an actual event, the sooner you get in, the better. But if it's just kind of growing and all of a sudden you just have that little pinch in your shoulder or a little back pain, give it a few days. But if it's still there within a week, that's when you want to start thinking, maybe I should take care of this before it really explodes on me.
Awesome. Some good advice this morning. Thanks so much for your time.
Thank you guys very much.
Have a great weekend. Jack has your forecast next. We'll be right back.